And good morning. You're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. I'm Mabel Jong, and I'm so pleased to have three gentlemen join me this morning in the studio. We have Kenneth Aldridge, Harris Rosen, and Ashley Bacot of Rosen Hotels and Resorts. Gentlemen, thank you so much for being here. And we just finished a very beautiful presentation of an awards ceremony with the Health Value Awards, and Harris Rosen Hotels and Resorts was recognized during that presentation. Let's start first with you, Mr. Rosen. You started this company years ago, and during that time of operation, you recognized that healthcare needed to be improved for your employees. Yes. What was the story back then, and where are we today?
Yes, well, we didn't realize really how horribly the system was working until we began to experience it. And so in the traditional way, we had a third-party insurer, and we thought everything was fine, but we noticed that our costs were going up every year. We weren't happy about that. So one year we decided to really hone in on the costs, and what we determined was that our costs were actually lower than the premiums. So we confronted the insurance agency and we said, why? They said it was a group that we're in. We said we didn't want to be in the group. And so they said, you have to. I said no. And we left the group, and that's when we decided to create our own insurance company. We became self-insured, and we created a whole new methodology for insuring all of our associates. Self-insured, our own medical facility, and that was the beginning. Okay.
Now let's turn over to Ashley here. Self-insured, how is that different from what we're seeing across the country? What is the experience at where you are at Rosen Hotels and Resorts compared to what we see nationally?
I think there are a lot of folks that are self-insured out there, and many folks that are much smaller than we are that are fully insured. There is a movement now that even smaller companies can become self-insured or modified self-insured. But in order to have a program like ours, in order to get maximum benefit out of it, one needs to be self-insured. Mm-hmm. And it's worked quite well for us. So the concept is not very hard to wrap your head around. We have our own docs and medical staff, and as soon as one of our employees becomes eligible to come onto the health care plan, we run a battery of tests on them, and we are basically holding their hand all along the way to keep them well.
Mm-hmm, mm-hmm. And when we talk about how this works day to day, Kenneth Aldridge, that's your job, to really be there and to recognize some of the needs of the employees. What's challenging about that if other companies wanted to replicate a similar model?
What's challenging about it? It's not very challenging. I mean, employers can do this. I mean, they just have to step outside of their box. They don't have to do what we've done where we're at today. They can start off small like what we did, a part-time doc, part-time administrator, part-time MA, and evolve based on what is their need. You have to determine what is the need of your population. What's challenging for us? 40% of our population are coming from third world countries. Right. That's challenging. Mm-hmm. We're having transplants. We're doing those type of things that is challenging to an organization from a cost perspective. But if we continue to do what we're doing, where we're controlling 75 to 85% of the cost in relation to chronic care, we save the money over here, and then we can use more of the money for the more challenging conditions. So it can be done. Okay. Just employers need to step outside of the box, be self-insured, get some sort of risk insurance, some third-party risk insurance, and just take that chance. Because we've done it.
Yes, I mean, transplants, that's ambitious. So in addition to running the hotels and resorts end of the business, you're running a medical facility as well, it sounds like.
Absolutely.
Was that your vision, Mr. Rosen?
It wasn't initially, no. I did think that we would ever be intimately involved in healthcare. It wasn't a subject that I was comfortable. I didn't know anything about it. But we've learned in 27 years. And it's not, as Kenneth says, it's not that challenging or complicated. And we've created a template. So we have 27 years of experience, and we can share with anyone exactly what it was that we've been through, the challenges we confronted early on, and where we are today. But the wonderful benefit is you save money, which is important in today's world, and you create a benefits program that is absolutely superior to 99% of what's available.
It sounds like it.
So it's the best of all worlds. Great benefits and savings.
Yes. Now, Ashley, can you give me a number on what sort of savings, what sort of investment had to be put into setting this up, and then what kind of savings are you recognizing now?
The investment that you have to put into it is a drop in the bucket compared to the savings. We have saved $340 million over the last 27 years.
When you compare our cost per covered life with the national average, right?
So our costs are 30 to 50% less than an identical demographic, and our benefits are far, far richer than the average. So we don't have any deductibles. Right. Our copays are very low. 90% of our pharmaceuticals are free. And so what we've done, in essence, and it's very commonsensical, is to lower the barriers to care. And when you do that through lower copays, no deductibles, paying people while they're on the clock while they're getting their care, when you lower those barriers, people will get care.
Yes. Okay.
In the traditional healthcare setting, when you have these high deductibles, people say, you know, I can't afford it, and so they don't.
Or if they have to pay for their pharmaceuticals,
right.
The great tragedy is they just won't buy them.
Right.
And that's terrible.
35% of Americans are delaying care because they can't afford it.
Okay.
So he's removed the barriers, and here more employers are cost shifting to the employee. We're cost shifting back to the company because it makes sense, where we've been able to create the 90% of our prescriptions are for free and has increased accessibility. And what have we saved? Well, more people are compliant with their cholesterol, with their hypertension and diabetes. Look at the backside. Yes, we might have paid a little bit of money on the pharmaceuticals. Where are we saving on the medical? If one person has a stroke, that's $90,000. I think a $2 a month drug is something that we can afford versus $90,000.
Sure, for sure. Give me a visual image of what this facility looks like for others who have not had the opportunity to see it in person.
Yeah.
How many doctors do you have on site at the facility?
We currently have 4 physicians, 3 nurse practitioners, 1 PA, a chiropractor, a podiatrist, full lab, full radiology, including digital x-ray, ultrasound, DEXA scan, take-home sleep studies, physical therapy, a dietitian. It's 12,000 square feet.
Fitness facility.
And a fitness facility, a full gym that our physical therapy department uses, and then we also have a multi-purpose room where we use it for Zumba, Tai Chi, kickboxing, and spinning classes. So it's 12,000 square feet. But again, employers don't need to do that, because we brought some employers in that look at it and say, I can't do this. Start off small, figure out your pain points, create more access, get the hypertension, diabetes under control, and that's going to be 75% of your spend right off the get-go.
And are you finding that the productivity data is clear? That if you have these employees that are taken care of right on site, they don't have to travel anywhere, right? They can walk to the facility?
Most of our employees can walk to the facility, but Mr. Rosen pays for transportation. So if somebody's not feeling well at one of our hotels, they can jump in one of our cars and they're taken right to the medical center and on the clock. So again, no barriers.
Right, okay. And you're seeing clearly
yes.
that if you have a healthy employee, you're going to have a healthy company overall?
Absolutely. And Mr. Rosen could talk about our turnover rate, but absenteeism, presenteeism, we've impacted all of that.
Mm-hmm. And are you finding that, Mr. Rosen?
Oh, absolutely.
I
suspect, I don't know this for sure, but I suspect we might have the lowest turnover in the hospitality industry, an industry that turns over like crazy. As does a restaurant industry. So we turn over almost single digits. The industry turns over maybe 50% or 60%. And it costs when you have to have somebody leave and then have somebody join the company and go through training. That's expensive. So we save all of that. But the basic premise is so simple. If you keep people healthy, you save money.
Okay. Ashley Bacot, Harris Rosen, Kenneth Aldridge, thank you so much for your time today.
Thank
you.
Pleasure.
Thank you.
Thank you so much.
And I'm Mabel Jong. Thank you for watching. Stay tuned. We have much more to come.